was wondering maybe whether you could start off with how you feel technology is very much fundamentally changing the way we think about health, even sort of before people ever become patients.
Thank you so much, and Your Excellencies, Your Highnesses, thank you so much for having us here. It's a real honor to be speaking at this panel. I think the question says it all. The way you phrased it, how does technology help health before people become patients? When there are people, there are families, our children, our parents, ourselves. And I think it comes down to how people in the world are now owning their own health journey, their own data, their own behaviors in a way that previously we relied on the medical system. So I think wearable technology, the use of wearables to monitor your sleep, your heart rate, your exercise, even your food, are really changing the information people have to make healthier decisions.
Thank you so much. Great overview there. Dr. Daniel, over to you. Maybe you could give us your take on all of this as well, and tell us a little bit more about what you're doing, because you're very much a biotechnology company, so tell us about what you're doing.
Yeah, I mean, I view it slightly different in the context of continuous medicine. We're going to use all of these tools to continuously essentially look at how our bodies are doing, and to use a computer system as an analogy. Obviously much more complicated than that. Obviously we need updates, and that's how we're going to be, I think, as we move. And I think the key elements to success in this path is data, and lots of data. Because if we think about the baseline for me versus, I'm Australian that spent a lot of time in the sun in Australia, so I have a lot of different issues than someone in Greenland that didn't. And that baseline data set is going to be absolutely essential for how we apply these ideas. And what we're doing is interventional. We use technology essentially to program cells inside our bodies to do what we want. But you can appreciate that if you have good baseline technology and you can apply that approach earlier, your outcomes are going to be, much greater.
Because biotechnology essentially is, technology based on biology. Can you tell us a little bit more about the side of that?
Yeah, I mean, biotechnology as a field actually includes a lot of things. It includes agriculture. I'm focused on human health and how we can apply novel technology to alter things that are going an aberrant pathway. And so what we do at Create Medicines is very, very simple but complicated. We focus on developing cost-effective therapies. That's the first and foremost. It's actually our number one tenet. There's no point in developing a cure for a disease if it costs $4 million, because no one can access it. Secondly, we focus on how do we train the body to help itself. I think this is absolutely going to be the path as we move in the future. And what's really interesting for us, serendipitously, is we take components of the COVID vaccine, which is now accessible everywhere, and we've taken those and we've engineered those in a way that we can apply it. So essentially imagine having, this is futuristic in some extent, imagine having an injection of essentially the same components, but if you had sickle cell correcting the gene, right? What we're actually doing in humans today is we take that technology and we train our immune cells to see cancer and kill it. And in the context of preventative medicine, there's actually a gentleman I know here in Dubai. He's a very, very fit individual. And on all of the things that you would look at, you would not think he had any problems. And he happened to have an MRI and they found a gallbladder cancer. This is 100% fatality, generally speaking. Because they found it early, he had a complete response on medicine we have available today. So it didn't even take a next generation medicine, it was something available. So even if we have the best tools to monitor things, we still have to think about how we integrate imaging, how we integrate all of these other areas.
So interesting, because I was going to move to Dr. Eleni, because how do you think technology is very much going to democratize healthcare. And tell us a little bit more about sort of data, AI, and this more sort of personalized approach to well-being as well, and what that's going to do when it comes to the future and democratizing that area.
So thank you for that question. I think one of the fundamental things that is changing now as people worldwide, regardless of where they live, have access to their own data, as well as access to large language models that, whether we like it or not, are giving medical advice directly to people. I think what will happen very soon is that we will get to a point where the accuracy of these models is such that patients and people will trust them, so we'll use them more and more. And the reason that's important is because access to medical care is extremely difficult, not just if you think of low and middle income countries, not just if you think of rural areas in Western countries, but even in urban areas, even for people with insurance, getting to see a doctor takes at least a few days, if not weeks, in some cases months. But when you're worried about your child, when you're worried about your health, being able to get an answer instantly is irreplaceable. And imagine a world where everyone, regardless of where they live, can get an answer instantly, even if that answer is not perfect, even if there are risks that the information may not be absolutely to the level of a specialist. The timing, the fact that you can get it in real time is a huge advantage. And so going back to this concept of democratizing healthcare, I do think that the use of AI in healthcare, the fact that a whole generation of humanity, of people on this planet, are now engaged with their healthcare and have the opportunity to get medical information that they didn't before, that was restricted behind the wall of having to see a doctor, is really going to change access to medical information. Now, it's our responsibility to make sure that information is high quality, is not in any way causing more harm by either being misinformation, incorrect, or giving false reassurance. And so at the Stanford Center for Digital Health, where I work, one of our goals is to bring together experts in academia and public health and industry to try and make sure that as these technologies roll out, we're doing it responsibly, we're doing it ethically, and we're doing it with the underlying values that we need for humanity. Because this technology is coming whether we like it or not, and I think people are going to use it in that moment when you're worried about a health question, whether it's ready or not.
Just very quickly, just staying on that topic, do you think LLMs today are equipped to sort of answer those questions right now?
You know, actually, I do. I think a year ago, maybe they weren't. They're definitely not perfect. They're not where they will be a year from now, and I hope we'll be having this conversation in 2027 with very different data. But you know, the truth is they are, you know, I use the term good enough, you know, and in that middle of the night, your child has a fever or you're worried about a decision, do I need to go in urgently? I think people are using them. We have some data looking at the accuracy of LLMs for mental health diagnoses, as well as, you know, the access to mental health providers in many parts of the world is extremely limited. And we've scientifically and rigorously assessed accuracy based on gold standards, and many of these LLMs perform extremely well. So people are using them, and there is evidence that they are good enough.
Okay, well that's actually quite good to know, right? Dr. Daniel, let's talk about personalization for a moment, because biotechnology, you know, very much uses personalization extensively, but with greater personalization, you know, there are new responsibilities, there are new risks at the same time as well. What are those risks when well-being becomes increasingly tech-driven, do you think?
I think our field has a lot to do to focus on empowering individuals. We have to think about how we make people feel empowered to make the decisions that they need to make. I think technology allows us to do that. 50 years ago, when you turned up to the doctor and the doctor gave you a prescription, at least in where I grew up, you took it, right? We live in a world now, if we're going to be serious about continuous healthcare, people are taking peptides, they're taking proteins, they're microdosing on GLP-1s. All of these things I support, but at the same time, they come with their own set of personal issues that come with it. So for me, when I think about personalization, I think less about, a drug that's designed for me, and I think more about what is my situation and what will help that. So we focus on actually making drugs that everyone can take, because I don't think making a drug for one human actually helps humanity. Humanity and empowerment, if we're going to solve problems, we have to be able to deploy a drug in Uganda as effectively as we can in the streets of Massachusetts in Boston. And so when we talk about personal medicine, I view it through the lens of how do we empower people to be educated, and how do we collect information that we can actually apply the tools that we have in medicine today and maybe tomorrow to maximize the health of that individual.
So how do we get the data, and how do we get this data as clean and as valuable as possible? What are the issues and the challenges around that?
This is actually, I think, a really important role of government. There are healthcare systems in the world that are publicly driven. Take my country of origin, Australia. The states actually hold all of that data. And I have conversations with the government there frequently to say, you are sitting on a gold mine of data. Think about having 50 years of data of a type 1 diabetic, right? And that you could actually take all of that data and look at not only like at a given time point, but temporarily over the age. What are some of the disease, complications that occur? Or if they were given a certain drug at a certain time point, what was the impact of that? So I think in the context of data, to build really amazing models, that's where I think the low-hanging fruit is. But I know there's a group coming on after here that take this very seriously to have a conversation, because there is investment from folks in the United States in this particular approach. The way I see it, if we're honest, I'm sure most of you know about Facebook. Facebook went public without making a penny, and really what Facebook, value was driven by was all of that data. And so I think if you look globally around those governments that are sitting on that data, the ones that can mine that the most effectively will be the ones that can help their people. They can drive strategies and policies that are very defined and actually can have very strong impacts over a 10 to 30 year period on life expectancy, quality of life, and so on.
Is there anything you wanted to add to that?
I think the importance of data is huge. What I would add to that is the new source of data, which is coming from wearables, from people themselves. And I think understanding that we can move from studying averages and studying the effects of interventions for a whole population to having N of 1 decisions based on data that the patient themselves have will also be very, very interesting.
Sadly, we've only got a couple of minutes left, so I wonder whether you could paint a picture of the future. What do you think the future is going to look like within healthcare with all this new technology that's coming in, and what is the sort of ideal scenario, and how can that be managed?
So painting the picture of the ideal future, I think what resonates with me is the conversation that we just listened to about traditional medicine and actually going back to the past. And if you can imagine a world where you can call your doctor instantly, where you have the wisdom of traditional medicine passed on from generations, but that is somehow incorporated into available tech-driven LLM that will give you not just instant, rigorous scientific advice, but that it's informed by generations of wisdom and is available the moment your child is sick in the middle of the night, the moment you have an injury and you need that advice. I think that would be an incredible vision for the future, where everyone in the world, regardless of where they live, what language they speak, can get the highest standard of medical advice, medical care, informed by science, but also traditional wisdom at their fingertips. And so hopefully that's something to strive for.
Dr. Daniel, what's your vision for the future?
I come back to people empowerment. I think the future will involve copious amounts of data and our ability to make decisions for ourselves. I think, in the context of taking a drug to drop your fever, we're just going to keep driving the bar up. And so your need to call a doctor is going to become diminished over time because we're going to empower people with education and access to therapies that are easier to administer, and we just understand how they work.
Sadly, we have run out of time, but we cannot thank you enough for being with us here today. Ladies and gentlemen, let's hear it for our panel. Thank you.
Thank you.